Just on me, you gotta turn the thing around. Okay, what if I start laughing in the middle of the speech? As citizens of the United States, it's hard not to notice opiates, or the opioids, overdoses being mentioned on the news every now and then. Today, I'm going to inform you guys more on this ongoing epidemic and give you guys some alleviations for the crisis that I've researched. Overdose deaths for opioid-based drugs, painkillers, were over 49,000 for 2017 alone. The rise in prescription opioid abuse in recent years has created thousands of addicts for opioids who take more and more of the drug until they die. 3 effective steps that can be taken in order to lower overdose deaths are: the opioid crisis is the term for the ongoing and recently increased epidemic of nationwide prescription abuse of opioid pain medication and its consequences. As of 2017, over 49,000 people died from opioids alone, as stated in the federally funded National Institute of Drug Abuse, which specializes in health and drug research. Opioids have been used as medicines for thousands of years, coming from the naturally occurring poppy plants. Their function is to depress the central nervous system and to increase dopamine release to the lowering feelings of pain and increasing happiness and relaxation, while also lowering one's breathing rate. That information also taken from the Institute. One of the most common and historically popular opioids used in medicine is morphine, for the purpose of pain medication. Stronger, more potent opioids have been synthesized and created, and since used in prescriptions for pain medication, like fentanyl. But they have also been increasingly abused, snowballing into the nationwide opioid epidemic. Steps that can be taken to reduce opioid overdoses are public outreach and awareness, increasing availability of antidotal drugs, and holding medical professionals more accountable with their patients. Public outreach and awareness on the opioid epidemic is key to many campaigns, such as that of the CDC's Public Health Matters blog. The CDC is a federally funded government agency on tackling public health issues, and has listed steps that can be taken to improve awareness, such as letting other people know what the crisis is, who it affects, and what you can do if you are on opioids. If more people were aware of what was going on, they could think twice before using opiates as pain medication, and would be more likely to follow directions for the medicine to avoid abuse. Antidotes for opioid overdoses come in the form of several medications, such as naloxone. Naloxone is an opioid antagonist, which can reverse opioid overdose symptoms, such as stopped or decreased breathing, as the Surgeon General says. Surgeon General is the government's highest authority on health matters in the USA, and is historically reputable by giving out public health advice. It is advocated that people have naloxone at home and with them as they go out, as it can save someone's life if they are having an overdose. Overdose deaths have increasingly been linked to the user being prescribed too much of the medication, or in other cases where doctors have illegally distributed medication to people without a prescription. Doctors all around the country have been looked at with more scrutiny, shown by the DEA's increase of funding into investigations of medical professionals, as seen in a CNN newsreel. An independent study by a medical team published the results about the effectiveness of anti-opiate drugs and increased medical oversight in the scientific journal JAPA, or Journal of the American Pharmacists Association. The study concluded that naloxone and increasing medical professional involvement in the treating of patients prescribed opioids have reduced the overall number of doses used and have reduced the number of fatalities from overdoses by 23%. Given that the 3 mentioned ways have statistically shown an impact on overdose deaths, they are shown to be useful tools in combating the epidemic. The opioid epidemic kills almost 50,000 people a year, yet the steps I have discussed could reduce that number drastically if they were implemented. The JAPA Journal states in the study that extensive political support for its measures was needed and allowed for the study to continue. So any kind of meddling into medical oversight or public funding of drugs such as naloxone would consequently require political support as well. The strategy of increased public outreach would not need any kind of political support and could be applied by anybody. You guys now know what exactly the ongoing opioid crisis is, what steps could be taken to reduce its impact, and the information is now out there for you guys and for anyone who wishes to change it. Thank you.